Hey, I'm glad you made it. We wouldn't start without you. It's time for an apple fritter. Here's your host, Jimmy Apple.
Welcome to another episode of An Apple a Day's The Fritter. I'm your host, Jimmy Apple. How you feeling today, my friend? You feeling good? You feeling strong? You feeling better than you did yesterday? Excellent. You can't ask for better than that. Today we have a sensitive topic. Have you ever heard of post-traumatic stress disorder, or PTSD? Now you hear a lot about this, describing people that come back from the war. Post-traumatic stress disorder is a mental health issue that may happen after a traumatic event. It's not just for people coming back from war. People that have a disability can also suffer from PTSD. If your disability is as a result of an accident or something like that, something of that nature, you very well may be suffering from PTSD. The thing to do is listen to this description that David's going to give us. And if you see yourself in it, the best thing you can do is talk to your doctor. You'll feel much better. They can get you on the right track to feeling better. So sit back, relax, and listen to what David has to tell us about post-traumatic stress disorder, or PTSD.
What is post-traumatic stress disorder, or PTSD? Post-traumatic stress disorder, PTSD, is a mental health issue that can develop after a distressing event. The event may be dangerous, life-threatening, shocking, or very scary. Examples include accident, fire, military combat, natural disaster, such as a tornado, physical abuse, sexual assault or rape, sudden death of a loved one, or something like a terrorist attack. The traumatic event may have happened to you, or you may have seen it happen to someone else. It's normal to feel upset after something like that happening. You may have trouble sleeping, eating, or doing things you enjoy for a little while. But with PTSD, symptoms last longer than a few months and interfere with your life. At least half the people in the United States have experienced a traumatic event. Among this group, 10% of men and 20% of women develop PTSD. Women experience neglect or abuse during childhood more often than men. They also experience sexual assault and domestic violence more often. Women tend to experience trauma differently than men too. There's no way to predict who will develop PTSD from a traumatic event. However, it is more common in people who have experienced certain types of trauma, particularly military combat or sexual assault. Injury during the event. Lack of support from loved ones after a traumatic event. Long-lasting or repeated trauma. Personal history of anxiety or depression, even before the traumatic event. Strong initial reaction to the event, for example, shaking or throwing up. Or very intense trauma. A traumatic event causes PTSD. But scientists aren't sure why some people get it and others don't. PTSD symptoms vary from person to person. Still, everyone with it experiences one or more of the following. Avoiding things. You may avoid people or situations that remind you of the event. Examples include friends you met in the military service, the part of town where you experienced the trauma, or crowds in general. Some people with PTSD try to stay so busy that they don't think about the event. Being on edge. The disorder can make it hard for you to relax or enjoy the things you used to. You may feel jittery or anxious. Maybe you're easily startled or always expect something bad to happen. You also may have trouble sleeping or concentrating. Having negative thoughts and feelings. PTSD can make you feel negative, angry, sad, distrustful, guilty, or numb. Reliving or re-experiencing the traumatic event. This can take the form of flashbacks or dreams. Perhaps a noise like a car backfiring or seeing something similar, for example, a fire, will trigger sudden, unwelcome memories. PTSD can lead to other issues with your health and life, such as alcohol and drug use, anxiety, depression, thoughts about harming yourself or others, or problems at work and in your personal relationships. Children with PTSD may act out the traumatic event when playing, cling to a parent or other adult, forget how to talk, or at least seem to, and wet the bed even if they know how to use the toilet. There's no scan or blood test for PTSD. If you've experienced a traumatic event and are having symptoms of PTSD, talk to a healthcare provider. The healthcare provider can make the diagnosis based on a conversation about your symptoms. To be considered PTSD, symptoms must last more than a month and interfere with your life. The most effective treatment for PTSD combines medication and trauma-focused therapy. Some medications can help your body produce more substances that manage stress and emotions. They fall into two broad categories: selective serotonin reuptake inhibitors, also called SSRIs. Serotonin norepinephrine reuptake inhibitors, also called SNRIs. Trauma-focused therapy examines the event and its meaning. It can be done a few different ways. Cognitive processing therapy. This method identifies negative thoughts and beliefs about the traumatic event and tries to change them. Eye movement desensitization and reprocessing, EMDR. You focus on specific sounds or movements introduced by the therapist while you think about the event. It aims to make the event less upsetting over time. Prolonged exposure therapy. This method encourages you to face thoughts, feelings, and situations you've been avoiding. You may talk about your trauma over and over. You may also work toward doing things you've been staying away from. You can't necessarily prevent a traumatic event. But some studies show that certain steps may help you prevent PTSD afterward. Ask for help and support. Believe that you can manage your emotions. Find positive meaning from the trauma. Focus on positive emotions and laughter. Help other people. Practice positive thinking. Stay in constant contact with important people in your life. Talk to loved ones about the event. And think of yourself as a survivor instead of a victim. Without treatment, PTSD can get worse over time. But treatment can help, even if the traumatic event was many years ago. For some people, treatment can cure PTSD. For others, it can make symptoms less intense. Your healthcare provider can help you find support groups for people with PTSD caused by a similar event. You can connect with others who understand what you're going through. If you think about hurting yourself or someone else, tell somebody right away. You can tell a healthcare provider, a friend, or a family member. You can also contact the Suicide and Crisis Lifeline at 988. You're not alone. There's always somebody who wants to help. PTSD is a mental health issue that lasts long after a traumatic event. It can make you feel negative and anxious. It can also cause you to re-experience the event or avoid certain things. If you have symptoms of PTSD, talk to a healthcare provider. Medication and specific kinds of counseling can help. If you feel like you might hurt yourself or someone else, seek help immediately. I hope you found this information interesting and informative. I'm gonna pass this back over to Jimmy. Have a wonderful day.
Thanks, Dave. And I want to remind the listeners, if you see yourself in any of those scenarios, please contact your doctor. And if you're feeling down, if you're feeling depressed, if you're feeling suicidal, please call 988. That's the suicide hotline number. Or you can dial 1-800-273-TALK. That's 1-800-273-8255. Again, that's a suicide hotline number. You can talk to people there. You can get your problems off your chest. If you don't want to talk to someone, you can text the crisis hotline at 741-741. So you have many ways to contact other people to discuss your problems. Don't go through it alone, but make sure to contact your doctor. This is a serious issue that can affect a lot of us. Don't go through it alone. And remember this, my friends, no matter what, things can always be worse. Remember that. Right now, there's somebody somewhere wishing that they were in your position. So things can always be worse. I want to thank you for stopping by today. You've been listening to an Apple Fritter. My name is Jimmy Apple, and I'll talk to you again real soon. Have a great day.
Join Jimmy tomorrow for another apple fritter. In the meantime, stop over at our YouTube group page, Living with a Disability, join in the conversation and make some new friends. See you next time.